Okay, here we go.
It's the new face of America. Surgery Boom. Here they are. I'm literally so obsessed with the fountain of youth served up in a cocktail of cosmetic procedures.
It's really interesting to see so much popularity on social media with all the various procedures that are being done these days. And definitely, there are people that are doing it much younger and are sharing their experiences much more openly.
Transplant, full face, facial fat transfer, rhinoplasty. Of course, there are the stars on screen.
That seems a little extreme. This young woman, her skin's very smooth, her nose is very straight, she looks great, did a whole lot of things, but if that's what she wants to share with her social media experience and she feels good about it, that's totally up to her. But sometimes people do take it a little too far, and younger people do need a little guidance, and that's the important part about finding the right provider.
We're back and we're refreshed. But now younger generations are trying to keep up with the Kardashians. Dr. Shauna.
Of course, the Kardashians are the originals, right? The reality TV was before social media even, and sort of getting a glimpse into what these people's lives were or what they are like is really why everybody so likes reality TV. And the Kardashians have recently been quite open about the different procedures they've had, things that they do to improve their aesthetic and their looks. Kylie Jenner most famously talking about her breast implants, and Kris Jenner talking about her facelift. So it's really demystified things for their followers and for their audience and the public altogether.
He says he's seen demand spike for deep plane facelifts. How has your demographic of patients changed in recent years?
I would say in 2019, most of my patients were above the age of 55. And now I would say the majority of my patients are between the ages of 45 and 55.
Among them, 45-year-olds.
I agree with that 100%. Dr. Lemmy is absolutely right. I think we're seeing people a decade earlier, maybe even more earlier than we used to.
According to the American Society of Plastic Surgeons, about 80,000 people opted for a face.
And I also agree with that patient. Nothing's going to lift like a facelift will. That's true. And so you have to think about the things that you're looking for out of a particular treatment. And if you're really looking for a facelift result, you can't really expect that from a non-surgical treatment.
Lift in the U.S. last year. Another 1.5 million plus got lip filler, and nearly 10 million received wrinkle relaxing injections like Botox, driven in part, doctors say, by more patients in their 20s and 30s. That demand fueling the explosion of med spas nationwide, jumping sixfold over the past.
That is an incredible number. 6 times as many patients have access to med spas.
Injectables, of surgery, of extreme skincare routines. So it traps women in particular in this sort of cycle of cosmetic enhancement that they can't easily exit.
Beauty reporter.
I think that's a little bit clickbaity or a little dramatic to say that you're trapping women into a cycle because they're interested in some cosmetic procedures. I think that people are educating themselves a lot more about their different options. I don't necessarily believe it's trapping people, but you need to be seeing providers that are giving you the truth, that are very, very honest with their advice, and that's why we have a whole medical specialty that is dedicated to aesthetics.
Scatafino says as the world becomes more virtual, it's also becoming more visual. One study finding that time spent on social media significantly contributes to desire to undergo a cosmetic procedure. Another factor, the surge.
I also get a little concerned about data like that, or especially when a news outlet throws up a single line that says something like social media means that people want to have more cosmetic procedures. It's possible that people who are interested in cosmetic procedures spend more time on social media so that they can learn more about the procedures, and they also learn about what is available to them. So it's not necessarily that the social media is convincing you need to have more cosmetic surgery, but you may already have a pre-existing interest, and it's probably a little more complex.
Weight loss drugs, and many patients looking to tighten.
Weight loss drugs have been a huge boon and a hugely popular drug and trend in America, obviously.
Dr. Bob Akazizadeh says the number of men he sees has tripled as advancements have allowed for more.
Absolutely true. Men are doing a lot more these days. They care about how they look a lot more now.
Surgery, and then all of a sudden, I'm seeing the husbands on my consult.
This happened to me yesterday. This woman who had a facelift, she said her husband said he's next.
Experiences with
with lip filler. My eyelids and my eyebrows look so symmetrical. I could cry.
As this cosmetic boom shows no sign of fading.
Good. Estamos